Hello, Board of Directors. My name is Molly Horrigan. I am the new Executive Director of Healthy Community Brookfield, and welcome to this board meeting. I'd like to present an organizational overview for you today. Some goals of this presentation. I would like to give you an overall view of what our organization is and what we do. I'm going to outline some of the environmental factors that interplay with our organization. I'm going to present a situational analysis of our organization, of our strengths, weaknesses, opportunities, and threats. This is also known as a SWOT analysis. I will present our current mission and vision to you, and I will also present a revised mission and vision that I have collaborated with our employees on. I'm going to provide strategies for our organization for a 5-year plan. And I'm also going to provide an action plan on how we can change our organizational output. I will also include how we are going to improve our evaluation process and monitor our programs and services. And finally, I will conclude this organization. First and foremost, our organization. As you all know, we are a nonprofit organization here in Brookfield County. We do provide 16 different programs and services to the community. These include nutrition education courses for teens, babysitting courses, group bereavement classes, caregiver support groups, women's health and primary care services, prenatal newborn care, mobile health medical services, employee health and wellness services to the area employers, case management services for elderly recently discharged from the hospital. We also provide violence prevention programs, smoking cessation classes, diabetes classes, teen after-school programs, school health, wellness, and fitness programs. We also do well water testing and water problem mitigation. And finally, we provide vaccine and immunization services to our county. All 16 of these programs are funded differently, either publicly funded through grants with the Public Health Department or privately funded through private foundations and different grants sourced from the area. Some environmental factors that are facing our organization and interplay with our mission. The community in which we strive is somewhat confused as to what we do. Our mission and vision is somewhat vague, and the community members do not really understand what we do differently from the area hospitals and clinics that are already standing. So we do have a kind of muddied relationship with these clinics and hospitals and schools because we are providing similar services to them. Therefore, the economics of our programs are somewhat repetitive. We're not getting the most bang for our buck, you could say. Our programs are inefficient because they're copying what is already provided to our community. So politically, for our future, we need to establish better relationships with these clinics, with these hospitals, with these schools, with our public health department, and really streamline these programs so that we can better provide for our community. Here's my SWOT analysis, so our strengths, weaknesses, opportunities, and threats. As an organization, our strengths, we employ 97 persons from across the county in different area hospitals, clinics, and school districts. And they've come from a very diverse background, which brings new ideas to our organization. We do promote health and well-being. That is our overall mission. Just by providing these different programs and services, we are doing good in our community. Our chief financial officer is great. He has a very sound financial development strategic plan in place, which I hope to continue in our 5-year plan. However, some weaknesses, our mission and vision statements are very vague. This does not paint a clear picture of what it is that we do as an organization, so I'd like to rewrite that. And like I said, we are copying programs that are already in place by the hospitals and clinics that are in the area. That leads to very poor transparency with our community members, and it leaves them in a state of confusion as to what we do. And finally, we did not meet accreditation requirements for the public health department, so we need to improve upon this. Some opportunities in our organization. With my new leadership, I'm hoping to change the new direction of this organization and really change for the better. So with this new leadership, we are heading in a new direction for our organization. Like I said, there's always opportunities for new financial resources, and our CFO is actively searching for new financial opportunities and grant foundations and all sorts of different funding opportunities. We do have a very, very exciting opportunity to collaborate with these area hospitals and clinics and schools. We can build relationships with these programs and really help each other to improve the public's health and well-being. And with all of this collaborations comes new volunteer opportunities for our community members. Actively engaging our community members in our mission is one of the primary goals for my 5-year plan. Some threats facing our organization. Like I said, the community is not in a clear understanding of what it is that we do, and this is definitely a threat to our future. With any public health organization, there is limited funding for our programs, which is very unfortunate. But like I said, our CFO is actively searching for new funding opportunities. Our accreditation status needs to change. This is very important. This will allow us to gain more funds from reputable sources. I need to personally, as our executive director, step up and implement these changes. And I need to build a new organizational culture that is founded in diversity and communication and hard work. And all of these are focused towards the health and well-being of our Brookfield community. And unfortunately, the employment of our organization is unstable. As with any public health organization, funding is scarce and limited. So funding for the future really needs to be secure, and that's what I'm hoping to help our CFO achieve in the future. So currently our mission as a nonprofit organization, Healthy Community Brookfield, strives to improve the community's health by strengthening the quality and performance of health and promotion and wellness practices through outreach, provision of services, and ongoing education. This is a very wordy mission statement, and I'm looking to change that. I believe that it does paint somewhat of a good picture. However, there's much room for improvement. Our revised mission statement. The mission of Healthy Community Brookfield is to continuously improve the health and well-being of every community member through programs and services that provide opportunities for a healthier, happier community. This paints a clear picture that we provide programs and services, and these programs and services are focused on building a happy and healthy community. I think that we can really change our mission and move forward with this. Our current vision. As a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. Overall, this is better than our mission statement. However, I'd like to shorten it a little bit because, again, it is wordy and it kind of confuses our community members. So, our new vision, Healthy Community Brookfield, works towards equal and improved overall health and well-being of every community member. Simple and straightforward. Part of our 5-year strategic plan. As I've mentioned numerous times already in this presentation, I would like to improve our financial stability. For our future, we really need to secure some funds that will help our longevity and improve our employment rates, but also improve the efficiency of our programs and services. So our CFO and I are working closely together to really develop a new financial strategic plan for the next 5 years. Another important thing that I would like to implement is increasing our community engagement and educational opportunities. As I said, the community is very unsure as to what we do and how we do it. So I would like to hold different workshops and community engagement opportunities so that we can educate the public on what we do. This will improve our overall public image, and it'll also improve our relationships with other public health organizations that are already providing many of the services that we already provide. An addendum to that, we will collaborate with different local public health organizations that are already in place and really improve the efficiency of all of our programs and services so that we can collaborate together and build a happier, healthier community of Brookfield County. So my action plan. Some tactics that I need to implement as our new executive leader is increasing the financial opportunities that are made available to us. This will really help our longevity as an organization and increase our employment rates, but also increase the efficiency of our programs and services. Different public and private foundational opportunities can really help us in the future. So I'm working alongside our CFO to improve upon these. As I said, I'm responsible, our CFO is responsible, our Chief Operating Officer is also responsible for this, but everyone is responsible. You as the board members, you are going to be helping us with this new strategic financial plan. Our stakeholders, our community stakeholders are going to be helping us. And that's where building relationships come in. Maybe there are different private foundations and trusts out there that we're unaware of because we don't have relationships with these grants or these family foundations that really actually want to support us. So building a relationship and building a better public image of ourselves will help get our name out there and also help us potentially secure more funding in the near future. As a timeline, this is a 5-year plan, but financial security is first and foremost on this list. We need to secure funding ASAP. As you and I well know, public health organizations are always facing funding issues, unfortunately, and that is the primary goal of this action plan. Some anticipated barriers. A lot of the times, plans like this tend to fade over the years. It is a 5-year plan, which is a long period of time. However, I'm hoping that we can all stay focused on this 5-year plan and not lose hope of our future, because we have to stay active. As an entire organization, we need to stay active in attempting to find new financial sources, new community engagement opportunities, all sorts of things that will help us in our organizational longevity. And the stakeholders involved in this. Obviously, as an organization, all of our employees, all 97 of us, are key stakeholders. You also are very key stakeholders, and primarily we're doing this for the community of Brookfield, so they are the most important stakeholder in this. And that is why I'd like to hold different focus groups with our community members on different programs that we might have to offer to them. The community is really our biggest partner, and we need to listen to them. Part of my new evaluation plan, we are going to monitor all of our programs on a quarterly basis. So I'd like to gather statistics on every single one of our programs, all 16 of them, on a quarterly basis. I'm going to work closely with all of our program directors and hold monthly meetings with each and every one of them to see how our programs are doing. And then I'm also going to start looking into college internships for college students to actually analyze our statistics to see how our programs are doing. This will engage the community in our programs, but it'll also help us evaluate and review and replan how we can make our programs better. So here are the steps of our evaluation, right? We're going to plan, we're going to implement these changes, we're going to monitor these changes with our new statistics, and then we're going to review them on a monthly basis. So in conclusion, moving forward, Healthy Community Brookfield has a great opportunity to really maximize our efficiency as a nonprofit organization and improve the health and well-being of our community. We should change our mission and vision to paint a clearer picture for our constituents, and we should also include our constituents in that mission by offering them focus groups and different opportunities for them to volunteer and different opportunities for them to become engaged in our programs. We have to implement our new evaluation strategy in order to improve upon our efficiency. But first and foremost, we need to become more active in our financial planning. If there's any further questions, I will take them, and you know how to contact me. And thank you for listening.